Thank you very much for giving me this opportunity. I'm so grateful and so delighted to members of staff, SCARF, Dr. Tara, Dr. Padmavati. Congratulations for organizing such an important event. I very much wanted to be there, but unfortunately, it wasn't destined for me to be physically amongst you. And I thank you for accepting this technology-based presentation, that I am there and you are listening to me. Schizophrenia is an illness seen across the world in a number of people. From time to time, its definitions have been marginally changing. Some call it a neurocognitive disorder. In older days, people called it cancer of mental illness. But whatever name we give, one thing which remains integral to this illness is stigma attached to it. No one wants to talk about it. No one wants to understand it. Those who suffer, they hide. Those who take treatment and become all right, they also hide. No one comes forward to speak to those people who are becoming new patients every year. There are no people who can inspire hope and confidence in young individuals that you will be fine. Why this situation prevails? Primarily because of the way society defines its role, the way society emotionally explains and understands a particular disorder, whether it is a physical disorder or mental disorder, as Professor Vig wrote in one of the editorial in Indian Journal of Psychiatry, that stigma is an emotional expression of a society. Unfortunately, people decided to isolate those people who suffered from schizophrenia, to discriminate those people, and thus leading to a number of issues related to human right, civil right, family life, isolation, divorce, separation, etc., etc. We all know about it. In next few minutes, I will be very briefly touching upon some of my thoughts about what stigma is, what has been done so far, and what needs to be done in future. Well, it would not be inappropriate for me to become a bit nostalgic. I salute Professor Vig, who started Open the Door program of schizophrenia, promoted by World Psychiatric Association, and I was one of the fortunate amongst others to be in the team led by Professor R. Srinivasamurthy and Dr. Vig. I fondly remember Dr. Vig and my respect to him. And it's also time to remember the world leaders, and no one can forget Professor Norman Sartorius, who brought in the concept of schizophrenia stigma research and took it in a number of countries. Quite a few studies were designed by WPA while in the time that he was the president. And it would not be out of place to mention that the WPA trial in 26 countries started in Canada under leadership of Peter Stewart at Kingston. I am fortunate to know each one of them personally. I've learned a lot from them and tried to carry forward some of the teachings that they promoted. Well, experience of stigma is universal. It's all over, whether east or west, north or south. What is different is in different society, people behave differently, understand differently, and emotionally express differently. What counts most is the public emotion. Then there are clinical consequences. People do not go for treatment, they hide, and the duration of untreated psychosis is more than 5 years, 10 years sometimes. Our neuroleptics produce side effects, which is also one of the prime cause for stigma. And media report, which has not played its role the way we anticipate or expect. All these factors, whether it is lack of services, accessibility of care, or media reports, side effect, clinical consequences, or public emotion, they are experience, they are expression of stigma, and each contributes in a square up manner to other factors. If we see how communities respond to stigma in different societies, we will find some differences and some similarities. Similarities are that stigma is universal, it's perpetual, it's increasing, it remains even after a patient has been treated, it remains even after a patient has been treated and employed, rehabilitated. Some of the factors which are very obvious is the dangerousness behavior, being avoided by friends, negative media portrayal, healthcare discrimination, discrimination by healthcare workers, personal failure, and significant social stigma and failure of state. If we consider Western country, we see more of negative media portrayal and healthcare discrimination. If we see the Eastern country, we find that isolation, discrimination, being avoided, and hiding and negative images are far more prevalent. In Western communities, there is a tendency to individualize the experience. They isolate more in themselves. Some of the factors which are truly important to consider is why stigma is much more in low socioeconomic countries. Employment, adequate mental health facilities, discrimination in healthcare settings, experiencing stigmatizing attitude, institutional problems are some of the important clinical issues which and social issues which are related to stigma of a particular illness called schizophrenia. If we compare that how prevalent is stigma in different part of the world, we won't find very little difference. Of course, stigma is much more in Asian countries, but we cannot say that it is lesser in any of the Western countries, varies between 30 to 60% of people showing significant level of stigma. Now let us consider that stigma prevails, it persists, and it persists much more in the individual, that is self-stigma. My issue is that has anything changed? What has worked and what has not worked? Number of treatments have been tried. Public awareness campaign, national campaign, treatments, increasing the treatment, focus treatment, etc. A lot of things have been done in number of countries. Treatment which failed managing stigma of schizophrenia. Let us consider what are these. The first one was traditional psychoeducation alone, and the second was one-time anti-stigma campaign, general public awareness program without personal interaction, inadequate integration of stigma reduction into treatment plans, and intervention without considering the cultural and social context. These are some of the interventions which we tried and have not helped us. And there is no reason that we should continue to repeat them. The generalized approach has not helped us. Let us see which treatment has succeeded in managing the stigma of schizophrenia. So the first is contact-based intervention, and the second, the cognitive behavior therapy for self-stigma. Public education and awareness program together has worked very well. A lot of studies have evaluated number of programs, and the findings are very positive. Peer support and advocacy programs, integrated mental health care and social services have helped. What has helped most is the legislative measures. You see, the typical difference between the Eastern countries and Western country is the governance of laws. In Western counterpart, we find that human rights issues are looked into. If there is a person suffering from a particular disorder, or becomes violent, or becomes aggressive, there is a very strong mechanism which works. That patient receives treatment, goes back home. We number of other countries which have these laws well in place, but the education about the laws and the governance is very poor. In our country, where you can see in number of corners a person sitting and hallucinating due to cannabis or drugs or because of chronic mental disorder, it is very difficult to provide intervention for that person. This is an issue well known to all of us. All of us face it in Indian practice, and we often feel helpless the why legal measures are so inadequate that they cannot help a person. Another treatment which has worked is educational program in school and workplace. So what do we need to do for dealing with stigma now? My suggestion is that we need to change the style of work practice. We need to see and focus more on person who is suffering from schizophrenia. We need better understanding of stigma in relation to schizophrenia. The practice of clinical excellence, program-based intervention, early intervention, improving the outcome are some of the priorities. Addressing risk for developing schizophrenia is one of the new area where we should not forget that it is not only important to treat symptomatic illness, it is more important to deal with the conditions which perpetuate and precipitate an illness of psychosis. Personalized medicine or positive psychiatry interventions are very important to consider. Practice of mental health legislation and positive narrative for people is also extremely important. New understanding and new hope. We need to reconceptualize the problem. Stigma is a clinical risk. It is a clinical manifestation. Like we treat positive symptoms, negative symptoms, cognitive symptoms, and affective symptoms. Similarly, there are other paradigms of schizophrenia. One certainly is presence of stigma. It needs to be assessed very carefully in clinical practice. It needs to be monitored, and one of the outcome parameters should also be reduction of stigma. And the treatment plan must incorporate how are you going to deal with stigma, how you are going to educate a family. Is the education enough to deal with stigma? Is stigma is one of the cause for relapse or non-compliance? The clinicians must think about it. There are neurobiological consequences and correlates. Number of studies have appeared, and we find that you see more cortical degeneration, more brain-related changes, more neurochemical changes, etc., amongst the group which faces high degree of stigma. The initiatives for early identification of risk is important. Education and training program is one of the main tool for dealing with stigma, but there is a serious uh, lacuna that people do not focus on it. We need more educational module, more training for people focusing on stigma, improving accessibility of care. Yes, I now see the number of psychiatrists is growing in our country, but the issue is not that you have a mental health professional or a service. The issue is whether a person is going to utilize that service or not. And therefore, need for legislative measures and are going to be revolutionary change in governance is important. Improving research and research tool is another important area we must understand. So better understanding of stigma in a psychopathological manner, we must consider that stigma is related to not only illness, but it is also related to outcome. The person, the patient is caught between public perception of his problem and need for treatment. He doesn't speak, and people who suffer also do not speak. So we should see stigma as one of the factors which is also cause and consequences. It determines the outcome, it determines the success in the treatment, response, remission, and recovery. I think this area needs more focused research, and I am sure in time to come, there will be better understanding on this parameter. We also need to understand schizophrenia in a manner that, as I said, that why stigma is a clinical risk, recognizing schizophrenia and the social determinants of schizophrenia, like childhood sex abuse, like addictions, like poverty, homelessness, etc. Stigma is also neurotoxic and leads to biological insult. We need to redefine the outcome measures and outcome parameters in that sense. Anti-stigma driven interventions are very important. Whenever we develop a care plan, we must include how we are going to reduce stigma. So we have cognitive symptom, negative symptom, affective symptom, suicidality, etc., as few parameters of an illness called schizophrenia. The most important outer shell is certainly the stigma. If we do not crack the hard layer of stigma in a person's illness, it will be very difficult to make the treatment acceptable to them, and it will be very difficult to provide revolutionary changes which are taking place in therapeutics. It will be very difficult to carry it to the person who is suffering. Clinical practice of excellence, psychopathology, and degree of stigma, no one seems to be stigma free. Our clinical practice must focus in a different manner. We all must be aware to assess stigma, should have tools to quantify stigma, monitor it. The intervention should be client centric, specific, tailored for every person. Program-based interventions work much better than general intervention. Yes, multidisciplinary approach is important, and it's available in a number of places, but there needs to be more and more focus on that. Compliance and continuity of care. These are some of the measures, clinical measures, which can improve outcome and also de-escalate the rising stigma. Rehabilitation, education, workplace, finding shelter, clinical care, and civil rights. So these are 5, 6, 7 areas which are of clinical relevance, and they needs to be brought in into the clinical fold of practice. The positive psychiatry approach, the individuals who, the concept of suffering from stigma is moving from society to person to individual. We first said it is a problem of society, but no, we said it's problem of person who is suffering from schizophrenia. But that is also not sufficient. We feel now that it is the problem of the illness itself. For example, individuals with low resilience, individuals with low self-worth, poor ability to cope, have high degree of stigma. And therefore, there has to be more optimism, more hope in reducing symptoms of stigma. Our approach should change to bring in stigma as component of psychopathology. And finally, what we need to do is mental health legislation and human rights parameters. If these measures are not implemented adequately and sufficiently, it will be very difficult to deal with schizophrenia, because people shy away reaching out. People keep a distance from someone who is suffering from mental disorder. This has to change. If society cannot change it, the law must come into and take over and support social measures to change. Though it is difficult and maybe not very satisfying to talk about dealing with the stigma, but my dear friend, hope is immortal. We survive on hope, and I'm quite confident that in times to come, there will be totally different approach in dealing with the stigma. the issue that whether social conscientiousness is going to play a role or not, I am very positive that it is only the social conscientiousness which will make a change in Indian society, particularly because our governance and implementation of laws are not that robust as it should be. Thank you very much for your time. Thank you very much for listening to some of my views.